As people age, there are many afflictions which limit their mobility and quality of life, and one of them is arthritis. Arthritis is a very common disease which affects joints and other organs of the body. And we at Zimmer, what we are trying to do is make people aware about arthritis, because once people are aware about their condition, they can do something about it. In recent times, when people are more concerned about their fitness, events like marathon are gaining a lot of ground, and we have seen over the last couple of years that Mumbai Marathon is one thing which really has worked well. And in this marathon, there is some of you would know that there is a special section which is for senior citizens. There is a walk, or there is a run, which is called as walkathon for senior citizens. In fact, this initiative has been taken by a magazine called Harmony, which comes from the Reliance Group, and this magazine is directed towards this age group of senior citizens. In fact, their tagline is celebrating age. So what we have done with Zimmer is tied up with Harmony, and we are using this platform to spread awareness about arthritis, to make more and more senior citizens know about the condition which they are undergoing, and what are the various options which are available to them on that. Hundreds of senior citizens are likely to come for this event. We had started this about 2 years back, and have got tremendous response on this. So this year also we expect lots and lots of senior citizens to come and participate in this walkathon. This time, additionally, what we are also doing is inviting a lot of people who have undergone treatment for arthritis, and today they can stand tall, and they can tell other people how they have fought arthritis and how they have been able to lead normal lives after that. So this would be an additional part of our senior citizen walkathon, which is a part of Mumbai Marathon this year. Regarding the conditions which affect senior citizens a lot on their joints, there is arthritis and there is osteoporosis. Arthritis can be of primary types, which means that if you put abnormal stress on the healthy joints, or you put normal stress on weak joints, it can lead to wear and tear of these joints. So that is called as primary arthritis. And secondary is related to when because of injury over a period of time, wear and tear happens to the joint, and that affects the mobility of people. That is of secondary type. Whereas on the other side, osteoporosis is a disease where the bones become very fragile, and because of that it affects the strength of the bone, and that can lead to various injuries also for these people, particularly in women in post-menopause period. Unfortunately, there is no known cure for arthritis. So what people who suffer from arthritis can do is go to their surgeon or doctor and check about various exercises which can help them to overcome pain and increase mobility. There are alternative therapies which are available which can help sometimes. Obesity is one of the major factors which affect patients. The more is the weight, the more the weight-bearing joints like knee has to bear that weight. So the good advice to these patients would be to reduce weight, to become more fit, so that their joints get less affected. So that is also one part of the treatment therapy. In most cases, people get benefited by joint replacement therapy or joint replacement surgery, because this can bring in pain relief and restore the physical function of the joints. So that is the reason why this is becoming a more and more common treatment for chronic arthritis cases. It is safe for most of the senior citizens to undergo joint replacement therapy. There are hospitals which take good care of this procedure, and which follows up with the rehab for these patients, and most of the time the outcomes are very good. In recent years, there have been many technological advancements in the field of various medical specialties, and orthopedics is no different. In knee replacement itself, there have been introduction of concepts like monocompartmental knees, or high flexion knees, which are helpful in particularly Asian patients which do a lot of bending of knees. In Zimmer, we also looked at the difference between men and women, the anatomical difference, and what we concluded was that the anatomical difference was very significant, and that meant that could we come out with a knee which would be more suited for women patients. And in 2007 we introduced gender knee in India, and it was received very well by the medical fraternity, as well as patient who had undergone surgery with this knee, because this knee was more suited for a women's anatomy, and it had lesser complication post the surgery. One of the recent things which have come up is patient-specific instrumentation. In this, what happens is a patient can have an MRI taken place, and then those images go back to the original country, and then from there the instruments which are made or designed specific to that MRI are being sent to the surgeon, and once that happens, the surgeon can easily do the surgery without any complication, and these are instruments which are specifically made for that particular patient. Many of patients are opting for this also. So this is also a part of new things which are coming up in orthopedics or joint replacement surgery.